Hey, big changes are coming to Medicare.
Lightning strikes and then you're gonna know my name.
Look, I've been helping folks with their Medicare choices since 1989. And I've seen a lot of changes over the years, but starting in 2025, it could be some of the biggest changes I have ever seen. Now, most of these changes deal with prescription drugs and Part D. So let's get into it. But before we do, if this is your first time here, my name is Keith Wilson, and I am a financial advisor helping folks just like you navigate their way through their financial journey. And hey, you may want to go ahead and subscribe to this channel, give this video a thumbs up, as I post a lot of content about Medicare and retirement. Okay, so what are the big changes? Well, first of all, the donut hole goes away. You see, before 2025, there were 4 coverage phases for prescription drugs. Phase 1, the deductible. Once that has been met, then phase 2, the initial coverage begins. Here's, you just pay co-payments or co-insurance, and that would vary depending on the medication. Now, once the costs have reached $5,030 in 2024, and that's between what you have paid and what your drug plan paid, then you enter phase 3, the coverage gap, which is known as the infamous donut hole. In this phase, you would pay a lot more out of pocket for the same meds than in the initial phase. And then after that, phase 4, the catastrophic phase. So once retail costs of your prescription drugs reach $8,000 for the year, then you pay nothing in that phase for covered meds. But all that is changing starting in 2025. So essentially, there are going to be 2 phases. Phase 1 is the deductible, which in 2025 is $590. Now, some plans may have a lower deductible or even no deductible, but none of them will have a deductible higher than $590. Now, once you have met that deductible, if any, then you enter phase 2, which is the initial coverage phase. And here again, you just pay the co-pays or the co-insurance for those prescription drugs, and the drug plan pays the rest. Now, here's the exciting part: no more donut hole. So no coverage gap, because starting in 2025, that has been eliminated. Once your deductible and co-pays or co-insurance amounts equal $2,000, then you pay $0 for the remainder of the year for your prescription drugs. So essentially, you have an annual spending limit cap of $2,000. And this is big time, folks. It's the first time in history that people on Medicare have had a cap on how much they have to pay out of pocket for prescription drugs. And this is for not only standalone prescription drug plans, but also Medicare Advantage plans as well. Now, this cap does not apply to the premiums or drugs that the plan does not cover. So you really need to do your research on the plans that are offering prescription drugs. Now, the next big change is the introduction of the Medicare prescription drug payment plan. So you see, some Medicare beneficiaries, they may have very expensive prescription drugs, and they may find it difficult to pay those costs up front. Now, this does not reduce your drug cost, but with the Medicare prescription drug payment plan, you are able to spread out the costs through the calendar year. So, for example, let's say you fill a prescription drug in January, and your share of that cost is $1,200. So instead of paying up front the $1,200, you would be able to spread it out over the year for, in this case, $100 a month. Now, if you select this payment option, each month you'll still continue to pay your plan premium, if there is one, and you'll get a bill from your health or your drug plan to pay for your prescription drugs instead of paying the pharmacist. Another thing to know is there's no cost to participate in the Medicare prescription payment plan, and you can participate at any time, and you can cancel at any time. This payment plan will work with either a standalone Part D plan or with a Medicare Advantage plan. Now, one might wonder, with the elimination of the donut hole and the max out-of-pocket of $2,000 per year for drugs, then might we see premiums increase on Part D plans and Medicare Advantage plans? Well, under the Inflation Reduction Act, it limits annual Part D premiums to 6% growth. Sounds good, but that is on the base beneficiary premium, not on each individual plan's premium. So I believe that we may see formulary changes take place. So even if your current plan covers your prescription drugs, that may change. And this is why it's very important to review those prescription drugs each year to make sure they are still on the formulary. Also, I do believe that some of these Medicare Advantage plans that offer all these other great benefits like vision and dental, we might see those reduced. Now, there are several other changes coming, but the last one I want to cover here is the mid-year statement from your Medicare Advantage plan. That's something new. So some Medicare Advantage plans cover things like dental, vision, hearing, fitness benefits, things like that. And if you haven't used any of those benefits, plans are now required to notify you if you have any of those benefits left that you haven't used yet. I think this is a pretty good idea, since a lot of people may sign up for a particular Medicare Advantage plan because of those ancillary benefits. It would be nice to be reminded that, hey, you have some benefits you haven't used yet. So with all these changes taking place, I would encourage you to review your current plan, compare it with others out there to make sure it is still in line with your needs. Now, the annual enrollment period runs from October 15th to December 7th of each year. So that is the time to take advantage of, comparing, make sure everything's in line. Anyway, hope this helps. If we need to talk, check out the resources below. Be sure to subscribe, and we'll see you next time. If you like what you're seeing so far, check out this next video. Subscribe to the channel. Lord willing, we'll see you next time.